Okay, so first of all, you need to understand there are some problems that are related to teenagers having sex. First is teenage, especially girls. Teenage girls, bodily, they are still not ready for sexual intercourse. They're just not ready. What are we worried about? We are actually worried about infection. Number one, you need to understand our uterus. You see, uterus is a very unique organ in the sense that there is a passage from outside to inside that goes all the way into the tubes, the ovaries, and into their tummy. Inside, we call the abdominal cavity, which is into the tummy. There is a passage. So if you think about it, anything can go through this passage, right? Bacteria, virus, parasites, worms, anything can just go in and go inside your body. But why is it that more often than not, we don't face this problem? Most women, they have sexual intercourse, but they do not get infection inside, in the sense that the bacteria or the virus doesn't go all the way into the uterus, the ovaries, the tubes, into our bowel, goes up to our liver. It doesn't. Why? Because in our uterus, there is actually a passage. There is actually we call a plug at the cervix, just as at the inlet into the uterus. There is a plug, and this plug actually blocks the infection from going in. So when you never had sex before, like most young girls and teenagers, there's no infection outside the uterus and the vagina. That means there's no bacteria, viruses, or even worms, or even parasites that stays in the vagina. There's none. It's so clean, it's so pure. The only thing they have is probably some of the good probiotics that are living inside the vagina. But when you have sexual intercourse, then all this infection actually gets into the vagina. For a mature woman, adult women in their 20s, in their 30s, in their 40s, in their 50s, these bacteria and viruses and parasites and worms or whatever, they will just stay in the vagina. They rarely go in. It's because the uterus is mature enough to block all this infection from getting in. So you have a uterus that totally blocked. Nothing can go in. But for teenagers, this mechanism is still not formed. So the infection, especially bacteria, they can go in through the cervix, into the uterus, into the fallopian tube, into the ovaries, and once it gets there, it can go to the bowel, it can go to the bladder, it can go anywhere in your entire tummy. It can go up to the liver, the stomach, and the whole tummy can get infected. And the thing is, because all these bacteria, when they infect you, you don't know what you will feel. What do women feel when they get this infection that goes all the way in? They feel maybe tummy bloated, a lot of gas. And if you go and see a GP, my tummy very bloated and a lot of gas. And if it's a teenager, a lot of times the GP will just treat it as maybe got gastric because teenagers a lot get gastric. So I give you some gastric medicine. So because they get gastric medicine, these bacteria continue to stay inside them and they don't get treated. So the infection stays inside them for months and months and months, and it causes more and more and more damage to the uterus, the tubes, the ovaries, all the way up to the liver, the stomach. And somehow, our own body, of course, we have our own immune system. So after a couple of months, most of these bacteria, our body will settle. We will kill all the bacteria and we are over with it. But unfortunately, the damage has been done. And what does it do? What does this damage do? Does it cause any problem? Yes. What is it? It can cause blockage of tubes. The main thing in these women are unable to get pregnant when they one day wish to get pregnant. Because teenagers, when they have sex, they're not thinking about pregnancy. But one day, they will want to get pregnant. And by that time, when they want to get pregnant, they will find out, hey, my tubes are blocked. Hey, I cannot get pregnant. Even my tubes are not blocked. Even if your tubes are not blocked, the damage around the tube, around the ovary, can also cause the lady unable to get pregnant when they are much later. Because once the damage is done, it's permanent. So usually it will cause adhesions around the tubes, around the ovaries, as well as it can cause hydrocephalus. So all these things, the damage is permanent. If you're talking about adhesions, it's still fine. You can do a surgery and solve it. But if you're talking about hydrocephalus, there's no way you can change it back to normal. Because you must understand the tubes go and catch ovary. The tubes go and catch the ovary. In the tube, this area, there's actually a lot of fine little hair that help the egg to move, help the sperm and guide the sperm and the egg to move within the tube. And all this infection over the months spoil all these fine little hairs inside. And as a result, the tube can either be blocked or even if it's not blocked, it may not be able to function well anymore. And this effect is permanent. There's no medication or surgery to reverse this situation. So as I say, many teenagers are not aware because probably nobody talks about it. But they do not know that because they have sex when they're teenage, some of this problem is lifelong. Is there a way to prevent all this infection? Of course, we will say best is not to have sex. But the other way actually is to use condom to make sure the boy uses condom during sexual intercourse. Sometimes as a parent, we like to tell them what's right and what's wrong, but teenagers is the most rebellious phase of our life. All of us have been teenagers. We know how rebellious we were. But the thing is, we still need to let them know, just in case. They have to know about this thing that can happen to them that can cause lifelong problem, irreversible.